My name's Brenda, and I'm just recently retired, which is exciting for me because I've been working for 45 years as a nurse at OSU. I think not being able to hear my patients when I was doing their assessments and asking them questions, and I would ask them to repeat themselves. I knew if I didn't have the answer. You notice you don't like talking on the telephone. You can't hear people. You have trouble hearing them. The cell phones were a little bit better because you could turn the volume up some, but then other times it got to where that didn't help either. And so I couldn't understand what people were saying. And I know they were probably thinking, what is she talking about? Because my answers did not match the questions. Well, first off, I think you think, oh, I'm not old enough to have hearing problems, and I think you just are in total denial for a while. Yeah, I don't think you realize how bad it is. I just went to the OSU Wexner Medical Center website and looked for a hearing doctor. They explained every test, and they were so thorough, I couldn't believe it. And I was amazed myself at the questions that they ask. It's very simple, and you're sitting in a nice little chamber, and you're very comfortable, and you've got headphones on, and everything else is blocked out. And it was just so easy. And the next thing I know, they're telling me, okay, you can't hear high pitches, and you're missing a lot of syllables on the words and things, and we can help you. At this point, my hearing aids are working so well, I don't know that I have the loss that I had before. I think I've regained everything, but it was scary when they told me that, you may not get all of this back if you don't get your hearing aids. And if you get your hearing aids soon enough, the connection between the ear and the brain will come back, and you will understand those words again. And I know, even as a nurse, maybe I should have realized that, but I did not know that you could lose the sounds of words totally and not be able to get that back if you didn't get your hearing corrected soon enough. My youngest granddaughter is very high-pitched, very talkative, very bubbly, and she's the one that used to like to whisper to me so much. She'd come up and whisper something in my ear, and I think hearing her voice and understanding what she's saying and not having to ask her to leave the room, let's go in the other room and you can tell Grandma, I think I enjoy that the most.